Catherine Duggan, as has just been introduced, and I'm the Chief Executive Officer of the International Pharmaceutical Federation. The Federation itself is, I'll walk you through the presentation first. Today I'm going to talk to you a little bit about FIP, tell you a little bit more about the Federation, the commitment we have to universal health coverage by mobilising community pharmacy today, that's the particular focus, and our role in primary healthcare. Then sharing some of the tests we faced as a federation and as a profession in the pandemic, with a particular focus on the community sector, because that's the face of pharmacy that many of you will recognise. A bit about the community pharmacy's response to the pandemic, during the pandemic, and what was needed then, and then about how we want to recognise that responsiveness and build resilience in the future as we come out of the pandemic or learn to live with it or face the new waves. So without further ado, I'll give you a little bit of an overview of FIP and my role within it. So we were founded in 1912, based in the Netherlands, in The Hague, as Hoof has just said. We represent over 4 million pharmacists and pharmaceutical scientists from the world. And we are a non-governmental organisation, kind of an umbrella organisation for many member organisations that comprise themselves of pharmacists. We have about 150 national associations and 180 schools of pharmacies and over 3,000 to 4,000 individual members. We divide our categories into sections. That's the term that we use, describing hospital, community, academia, industry, military and emergency pharmacy, clinical biology pharmacy, those who work in administrative roles and policy. I mentioned earlier, we're a non-governmental organisation. We've had official relationships with WHO since 1948. We work with UNESCO with a programme called UniTwin, whereby we share expertise from academic centres in countries that have a lot of schools of pharmacy with countries that need to establish schools of pharmacy. And in essence, FIP works in partnership, collaborates, and really tries to align our programmes of work to help everyone else. Our vision is for a world where everyone benefits from access to safe and effective medicines and pharmaceutical care, never more appropriate than during the pandemic. And our mission is to improve global health by supporting the advancement of pharmaceutical practice, sciences, and education. So our focus is to kind of achieve global health through what we can in pharmacy. And of course, that really puts the impetus onto the patients and the public that we serve. So I joined the Federation as CEO in June of 2018. I've just celebrated my 4th anniversary in role. And that October, we went to Astana. That was the 40th anniversary of a commitment, a global commitment to primary healthcare. And there was a lot of reflection going on during that meeting and a lot of understanding that whilst 40 years had gone by since the globe had committed to doing its piece in primary healthcare, there was still much to do. We have seen a shift really from perhaps living with I say communicable diseases 40 years ago, and of course we are in the midst of a pandemic, so that seems to have come true. But we also now have many diseases caused by lifestyle that hit many of the Western worlds, and while people live into old age, they may not live into old age with good health. So we wanted to make it very clear that we were committing pharmacy to delivering the Astana Declaration, and we've aligned our work plans since then in many, many ways. We have done that by devising 3 big areas of work around non-communicable diseases, the prevention agenda, and the safety agenda. Now, the UN defines 5 main non-communicable diseases as cardiovascular disease, cancer, diabetes, mental health, and respiratory disease. But pharmacists, especially those in community, have to manage patients with 1 or more of those, and maybe with dementia or motor neuron disease or Parkinson's or any other combination of diseases that are non-communicable. The prevention agenda could roll from managing self-care all the way through to immunisation. And of course, the safety agenda is about how medicines are made, managing substandard and falsified medicines and hopefully getting rid of them, all the way through to supply chain issues. And I'm sure all of you on the call will understand that those kind of came together and had a multiplying effect during COVID in our communities. By signing up to Astana, we then were able to establish a more specialised memorandum of understanding with WHO, not only to focus on the Astana Declaration, but really to strengthen our workforce, our healthcare workers, our commitment to that, and delivering in primary healthcare and safety. Part of that work then meant that we built on the development goals we had launched in 2016 around workforce, and we expanded them and added to them to launch 21 development goals in 2020 to transform global pharmacy. They're very much aligned with the Sustainable Development Goals, so that our pharmacy organisations in countries can do very much more about aligning their work with the policies of their health ministries and with the needs of their nations and with the patient and population priorities that they have. So I just want to walk you through some of the tests we faced at FIP as we found ourselves in the middle of a pandemic of global concern. And I do believe that the date that was mandated by the WHO was the 30th of January, 2020. And that date has marked where we've started some of our programs of work, fully understanding that the pandemic was gaining pace in the weeks and months before that. So I'll walk you through some of the challenges and some of the responses we made as a federation for our profession. But before I do that, I just want to highlight for you some of the invisible infrastructure that community pharmacy provides. Now, I'm focusing on community pharmacy today because that really is the side of pharmacy that most of you will have experienced. But of course, we have pharmacists working in hospital and industry and in very many other sectors, as I mentioned earlier on. But you will find pharmacists and pharmacies in all communities, in all nations across the globe. And whilst the business models or the remuneration models change from country to country and adapt, there is probably 2 or 3 ways in which health services are funded, which includes taxation, which includes universal coverage, which includes insurances, or a blend of all of those. And the way pharmacy works is that it sits slightly outside of the healthcare system and kind of holds the medicines that the populations need for that community. In addition, community pharmacy employs from the local community, so they really understand and get and really can have a feeling for the communities they serve. So there is always a health workforce, whether they are called community pharmacy assistants or technicians or any other label. They're employed from the local community. So not only does the community pharmacy hold the medicines that people would need, they also provide many unseen services like domiciliary visiting or deliveries, and they act as a point of access. And prior to the pandemic, this was going on routinely, maybe providing services to nursing homes, maybe providing services to GP surgeries, maybe providing access for podiatrists to practice in their pharmacies, and always thinking about the supply of the medicine a patient wants, maybe in some countries with the ability to prescribe themselves, and to ensure safe and appropriate supply of the best medicines for that patient and their family. And as our communities closed down in the pandemic, the one health profession that remained open across the globe was the community pharmacy. And this offered, I think, patients and the public an opportunity to see what pharmacy could do and also to see how flexible they were being. So I'll come to that in a little moment. We had to basically pause our work, stop what we had planned for 2020 and react and respond. And pharmacists are quite risk-averse professionals. So responding without all the evidence all the way through has been a really interesting experience for us as a profession. We had to provide calls to action and advocacy initiatives. We had to kind of respond to the needs of the different countries that our pharmacists were working in. Plus the fact, if you will remember, much of Europe, when that started to gain infection speeds and rates, different countries were experiencing that at different times. So we were trying to learn from countries within a region to share with other countries as they were going to be going through the same experience. We had examples of good practice for community and hospital. We would really share and showcase that wherever we could. We provided resources on diagnostic testing. We provided emergency guidelines, which for pharmacy was quite tricky. We had a new form of response and information provision through holding statements and the ability to adapt our policies. Many of you will remember that the advice was changing, if not weekly, then daily, about the different therapies that were being repurposed, as well as therapies that were being invented. And we had to respond to the vaccines and the tests to see how they were being implemented. We translated our guidance so that everybody could have access to it. And we had guidance based on the following issues. We created a dedicated web page that was open and accessible to everyone. And that meant that other professions could use that as well, which we found was very, very accessible. We had around 250 events, much like this, digital events since March 2020. Prior to that, we'd had about 10 digital events a year. So that has really changed. One thing I will say is the more digitally you can engage, the more equitable that is for many low-income countries, for people who cannot travel to congresses. And we are continuing with that. That will be part of what FIP just continues to do as our bread and butter. We had an online platform with about 40,000 members established, and we created a repository of resources, and we thanked our professions, our professional associations globally for sharing their work with everyone else as well. Lots of statements and scientific or technical or professional positions were published. And then we started our advocacy. We saw some countries, the ministries of health and the governments, enabled and supported pharmacists to act at the top of their license, or maybe even to take small bits of professional development to take on new roles. And we saw that that could be shared and mobilized in other countries. We issued a call to action to support pharmacists and their teams on the front line, which included 23 urgent measures. I mentioned that pharmacy, community pharmacy, very often sits on the outside of the health service. Well, that was really clear in terms of the PPE that was available. So we called that governments would consider community pharmacies in their first line. And pushing the digital health agenda forward, we produced different reports. That report you can see on the screen is available on our website if any of you would be interested. And again, we've seen that other health professionals have been interested in that, and members of the public as well. In the development goals I showed you right at the start, one of our development goals, number 10, is around equity. Previously, when these goals focused primarily on the workforce, that was thinking about gender equities in the pharmacy workforce. Now we considered equity much more widely. We saw inequities in all our countries being highlighted and exposed, existing inequities as well as new through the pandemic. We saw that the way the virus and the infections hit the older populations more than the younger. We saw the ways in which some of the preventative measures hit the younger populations even as much as the elders, as we were restricted in our activities. And much of this, the consequences of all of the lockdowns we've experienced are only really coming to light now. And that's really another piece in the jigsaw for how do we support the professions to identify, spot and support some of the issues around, say, mental health. So we published our Equity RX collection, Inequities Unmasked. We thought that was quite a cute title for it, at the end of 2020. And we have many more resources on equity now. We supported and promoted the WHO Declaration of Vaccine Equity, and we still really promote this. We just do not see that this is, how would you say, sustainable longer term. If we don't have everybody having access to vaccines and to good therapies, then we will really see new variants emerging. We've seen that all the way through the years that we've been living with COVID now. What we try and do then, colleagues, is that we'll issue a statement and then try and support our colleagues in their nations with their particular issues, so that it isn't like a global one-size-fits-all. We adapt it to the needs. And then, of course, we provided holding statements on the role pharmacists could play in diagnostic testing. And that then became the mandate for pharmacists getting engaged in vaccinations themselves. I thought I'd just spend a couple of moments to walk you through how pharmacy, in particular community pharmacy, responded to the pandemic. And bear in mind, there was no blueprint for this, as we all know. So we were really kind of, I think, reacting blindly, and also having to make very, very quick decisions, knowing that our decision to provide certain medicines in a safe way was better than no decision or waiting for the evidence to be 100% ready. So I mentioned earlier on that in normal times, community pharmacy is often the first point of contact. But actually, in the pandemic, our community pharmacies found themselves globally to be the first point of contact. And where, for example, you might have one of your loved ones in a care home, or you're unable to visit them, you could go to the pharmacy to get some advice on how to handle yourself and how to handle them and how their medicines could be handled. What we saw was community pharmacists were really seeking to be supported in their educational role, especially important at the first phase of the pandemic. That still goes on now. And I think it's really important that while that happened, perhaps March, April, May, June in 2020, it's still happening now. But what's happened is that the communities are more tired, more exhausted as we come out of the pandemic and we face the iceberg of unmet health needs, but also so are the professions. So it's really important for an organisation like FIP to consider, how do we keep supporting our members and the profession? They were at the front line providing supplies of masks and PPE and producing, in many cases, hand sanitizer. So a lot of the pharmaceutical skills there. Patient referrals, video consultations were really important, especially as people found themselves in and out of lockdowns. Urgent supplies of long-term prescriptions were managed really effectively across the different communities. And of course, I've mentioned earlier the point of care testing. There was an awful lot of roles, though, that were needed around shortages, health products and medicines. You'll remember there was a lot of shortages in many areas. Luckily, the medicine supply chain remained pretty well oiled across our different communities. Management of minor ailments, potentially really even more important as routine checkups with family physicians or GPs kind of contracted. In many countries, we saw expanding prescribing roles for pharmacists and also vaccinations. Maybe they had been trained previously in flu vaccinations, so that was extended into the COVID vaccines. And if they could not vaccinate, then they often opened their community pharmacies as vaccination centres. We saw pharmacy home delivery services for vulnerable people, as well as delivery to nursing homes, and really a focus working with the hospital colleagues to provide specialty medicines for, let's say, HIV, cancer, multiple sclerosis. We saw the scope of practice expanding in many countries, and this was used as a template for the countries that were struggling with access to healthcare. So this was an example of how this scope was expanded in Canada, and we use that in Germany and Italy and in other countries across the globe. Urgent supply of long-term prescriptions was really important. And you'll see that in different parts of the world, different governmental initiatives were used to enable better supply, better access to medicines, better access to vaccinations. We have seen that the ambition in 2016 was there would be 50 countries with pharmacists vaccinating by 2030. We've actually far exceeded that, and there are about 75 countries that have pharmacists involved in some form of vaccination. We created counselling guides to help, especially with diagnostic testing, so that community pharmacists could be fully equipped. So in conclusion, colleagues, before I come to what we're going to do next to build resilience, the pandemic highlighted the importance of community, hospital and clinical biology pharmacists to ensure continuity. I focused here on community because I think this is the one that you would have the most experience of. But if you think about it, medicines were continually supplied, so were medical devices, and the community pharmacist was there to be able to advise on the optimum use, or maybe replacing a medicine that might be in short supply with another. There was a health education role, and also ways in which we could ensure patients and the public prevented infection and stayed safe. Now we enter into the next phase, I'm not sure if we can really say after the pandemic, because we still see ourselves in the pandemic, but after the lockdowns and after the isolation measures, it's paramount for us all to note that the services we delivered and the value they contributed are maintained and continually recognised. What we're trying to do now is to ensure that many of the innovations that health ministries undertook are maintained. And then we need to focus on building resilient communities through pharmacies. What do I mean by that? Well, I think to have some recognition of the role that a pharmacy can play, to make a pharmacy very, very visible as a hub for education, advice, your medicine supplies, your family's safety is really an important thing now. But then also to support the pharmacy teams in that endeavour will be really important. So we've got plans now for 2 phases of preparing for the next pandemic. We have noticed in the many days, many weeks since the pandemic was announced as a pandemic of global concern, that the resilience or the, what would I say, the ability to manage stress is waning in most health professions. We work with the Health Professions Alliance, which is medics, pharmacists, nurses, physiotherapists and dentists. And we've all noticed that our health professions are pretty frazzled, as are all our communities. So it's really important that when we think about moving to pandemic preparedness, we look really carefully and thoroughly at what we have learnt throughout the whole of this pandemic. So we have now got 1,000 days of recognition. We are mapping out the 10 blocks of 1,000 days since January the 30th, 2020. And the 1,000th day, living with COVID, will land around the 4th anniversary of that Astana Declaration. Let's say the 24th, 25th of October this year. So on that day, we will be presenting to the profession the 10 blocks of 100 days and showing how we responded, reacted, and how we learned from each other. And each of our member organisations will be able to chart that and to be able to see where the tipping points occurred. Where in your country was really the most stressful 100-day block within the pandemic? What was happening at that time? What could be learnt from that? I'll give you an example, colleagues. If I highlight for you Lebanon, we know that they were suffering a lot of financial and political upheaval and challenges before we even entered the pandemic. The pandemic hit them very hard. And then, of course, they had the Beirut blast on the 4th of August, 2020. And I can honestly tell you that since then, the resilience of community pharmacy in the Lebanon and in Beirut in particular is really shattered. On that day, 10 community pharmacies were razed to the ground and all the medicine supplies that they were holding were just disappeared. So all of the Beirut community pharmacy network was massively disabled. We also can tell pharmacy right now in Ukraine is really suffering and struggling. And then we have had other disasters, man-made and natural, in the meantime, which have really disabled how pharmacy can respond and how patients and the public can respond in their country. So the resilience is really low, but it's not like having one size fits all. So where we will map out the 1,000 days living with COVID, we want each of our member organisations to describe their experience as well and see how we can support and help. It might be as simple as a letter to their government to be able to show that community pharmacy needs to be considered as part of the healthcare system. It might be a set of toolkits, guidance. It might be putting them in touch with another country that has a similar experience or has some signs of success or case studies of how they've managed to respond to the pandemic. We've also divided that 1,000 days up into different categories: responding, living during, and then preparing for the next. We know from talking to our members that if we go straight into preparing for the next pandemic, psychologically, this will bring the profession to its knees because they need a time to reflect and respond and consider all the lessons that they have learned through the pandemic itself. So after our reflective time in October 2022, we're going to set up a preparedness workshop. This will be how pharmacy can be supported in every country. This will also be fed into the WHO's pandemic preparedness response, so they can see that pharmacy is stepping up to the plate. We will align all our work with the different goals in the different countries and enable our member organisations to be able to propose to their health ministries or to provide evidence to their health ministries of just how effective or impactful they are or could be. I've listed a few things here that will compile the pandemic preparedness for the next pandemic that we might face. And we've learnt this because this is what we produced this time. And what we will do is some humble review on what we could have done better, quicker, faster, or what would have been even more essential for our member organisations. We do know COVID guidelines that were responsive, impactful, and could change over time were really important. We do know that having a set of digital events that allowed people to come together and talk about the struggles they were having helped with their resilience. We do know that having some pearls and some jewels from the digital events really helped them. Regulatory self-assessment tools, policy tools, advocacy, helping them to mobilise the workforce they have, helping them to argue for the workforce they needed, shifting tasks and sharing tasks to allow for their teams to be more flexible. These all came into their own. They were really, really important. Being able to identify new services, but getting remunerated for that so that you weren't just doing it on top of everything else was super important. I'm really happy now to take some questions and to feedback more. I thank you so much for this opportunity, and I look forward to having a chat with you in the coming minutes.